Welcome to CJASN podcast. I'm Alan Yu, a nephrologist from the University of Kansas Medical Center, and today we'll be summarizing the main findings from our recent paper in CJASN entitled Relationship Between Total Kidney Volume and Estimated Glomerular Filtration Rates in Autosomal Dominant Polycystic Kidney Disease. Autosomal Dominant Polycystic Kidney Disease, which I'll refer to here as ADPKD, is a devastating disease with only one approved therapy so far, which is tolvaptan. Our long-term goal is to accelerate the rate of approval of new therapies for this disease. So in other diseases, approval of therapies is greatly increased when there's a surrogate endpoint that can be used in clinical trials. For instance, the acceptance by the FDA of proteinuria as a reasonably likely surrogate endpoint in IgA nephropathy has led to a flurry of new drugs for this disease just in the past 3 years. Well, in ADPKD, we also have a reasonably likely surrogate endpoint that is recognized by the FDA, and it's total kidney volume. Total kidney volume can be measured by MRI and is commonly used as an efficacy biomarker in clinical proof-of-concept trials. But to get accelerated approval of a drug for ADPKD, one needs to demonstrate a treatment effect on total kidney volume that is sufficiently large that it would be predictive of a meaningful improvement in the clinical outcome, usually GFR slope, in a subsequent post-marketing trial. So the problem is that the relationship between the magnitude of change in total kidney volume and the magnitude of change in eGFR is not known. So in this study, we developed an approach to model that relationship. We used longitudinal data from the CRISP and HALT studies, which together provided a total of 487 patients that were followed for a median of 3.2 years. And what we found was that in rapid progressors, which are the patients most likely to be tested in clinical trials, for each 1 percentage point per year reduction in total kidney volume growth rate, the rate of decline in eGFR could be predicted to be reduced by between 0.4 and 0.52 mils per minute per year. So this new model provides a framework that drug developers can now use to define the magnitude of treatment effect on total kidney volume that would be needed to support accelerated approval of a drug for ADPKD.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.